My talk today is entitled Strengthening the Public Health Educational Strategies in a Post-COVID-19 World. So as we know, the COVID-19 pandemic had impacted the global community in a devastating manner. In Malaysia, the first case was reported on the 25th January 2020, and on the 11th March, the WHO declared COVID-19 pandemic. Malaysia had her second wave on the 18th March 2020, and we had our third wave on the 20th September 2020. So 2021 saw an increasing rise in the cases, in the number of cases as well as death, but also the implementation of vaccination program among the Malaysian population. And as of today, on the 14th September, as of 14 September 2022, globally, the COVID-19 pandemic has affected over 558 million people with 6.4 million deaths, and in Malaysia, 2.8 million cases were recorded with 36,000 deaths. From the public health perspective, the COVID-19 pandemic has caused huge impact to the healthcare services. And as we know, health contributes to the overall development of a nation and is an important factor in reducing poverty in many countries. Therefore, to achieve health, most nations will invest in comprehensive infrastructure as well as highly trained workforces. Public health knowledge, expertise, and skilled workforce play critical roles in prevention of disease, promotion of health, developing health programs, as well as monitoring and evaluating the health systems. For us, in National University of Malaysia, we have our teaching hospital, which is the Hospital Chancellor Dr. Mukhris. And during the pandemic COVID-19, we are the hospital. Our hospital is one of the designated admitting hospital for the COVID-19 to manage the COVID-19 cases in the country. So, of course, during the pandemic, for a teaching hospital, serious issue of clinical teaching and learning was affected during the pandemic. Various domains that we have in our teaching hospital, we have the clinical teaching, we have also the preclinical teaching, allied health training, as well as the nursing training. And don't forget, also we have the laboratory component for the students, and as well the research that the students for their projects and dissertation. Just to share some photos and our experience during the height of the pandemic, the Crisis Preparedness and Response Center, our hospital was activated. And we had our postgraduate students in public health involved with activities such as disease surveillance. They are also encouraged to practice what they have learned in risk communication. And here are some of the activities in the bilik gerakan or the CPRC, whereby we have the daily updates of the cases that has been reported and recorded in our teaching hospital, and briefing by each unit. So we have, for example, the case detection unit, contact tracing, disease surveillance, and health promotion and others. And we also have a very close networking with the health authorities in Malaysia. For example, we conducted video conferencing with the CPRC Ministry of Health Putrajaya, as well as the nearest health office, which is the Cheras Health Office. And after all those activities, it is very important for the preparation of reports and also information dissemination to the faculty members as well as the hospital. Part of the dissemination of information, we have the weekly bulletin on the Bilik Gerakan COVID-19 HCPM, where each department that were involved in the management of the COVID-19 will tell their stories and share their experiences as well as the challenges that they face. And this helps, I think, interdepartment sharing of the information to improve the services. These are some of the postgraduate students with their lecturers, and I think it is very important, also beneficial for the students when they were actively involved in the disease surveillance management. So for schools of public health as well as allied health sciences, they certainly play a key role in the production of this highly trained workforce. Traditionally, public health education and training has focused on competencies in areas such as epidemiology, statistics, health systems, disease prevention, health economics, environmental health, as well as the occupational health. But the occurrence of the COVID-19 pandemic with its devastating consequences has certainly highlighted the existing inequalities and inequities around the world. And of course, in Malaysia, we have also experienced certain parts of the country. Therefore, managing the pandemic requires more than the usual biomedical approaches. It is necessary for us to take a step back, and we need to incorporate the broader social sciences approach to health. Our students need to be trained to have the ability to listen and learn from existing diverse communities and health systems. They also need to have the flexibility and the capacity to work across sectors, and recognition of social justice, equity, and human rights as basic principles, while undertaking public health actions in diverse contexts. This certainly has stimulated re-evaluation of the public health education. However, a strengthened public health can emerge from the hardships that these workers have had experienced during the pandemic COVID-19. So in our teaching hospital, for example, students, the future public health or future workers need to have the capacity to see at the hospital capacity, for example, the bed occupancy rate, and they also need to have the skills of acquiring and understanding the distribution. We have the accountability, and with continuous education, we also need to practice of observation and also have the ability for the innovation. This with regards to, for example, acquiring equipment, medication, and then during the consumables. And they also need to have the ability to negotiate and also obtain funding from the government agency, the private sectors, as well as work in or buy in the NGO. And not to forget, most important, the human resources to secure adequate numbers of doctors, nurses, as well as the auxiliary staff. So we need to further strengthen capacity, competencies, and knowledge on the politics of public health, strengthen the community engagement, as well as further encourage interdisciplinary research. Training and expertise in supply chain management, as we saw in the earlier diagram, the ability to quickly and skillfully secure procurement, storage, distribution of the drugs and medication, securing the personal protective equipment such as masks, gloves, aprons, overalls, and so on, as well as the equipment, the ventilators, and also most importantly, the vaccines. They need to have to acquire the expertise and the proficiency to identify and diminish the effect and spread of misinformation and fake news. This we saw a lot during the pandemic and when during the we want to advocate on vaccination. So WHO refers to this as spread of misinformation and fake news as infodemic. Development of expertise in learning and application of technology in collection of data, synthesis of the available information, and dissemination of the decisions in a timely manner. We saw that during the pandemic, they have to quickly decide in order to stop the disease from advancing further. And also during the height of the pandemic COVID-19, the teaching switched from the traditional face-to-face or physical classrooms to the online classroom, and various platforms were used by different medical schools, but it's online. So digital technology has been increasingly a focus of teaching and training. Machine readable technology and artificial intelligence will be a game changer in diagnosing, assessing, and managing health systems, especially during emergencies and as mentioned earlier, the future public health workers need to be able to negotiate with international and local funding bodies to provide funds to help develop updated public health programs and to support further research. For future public health workforce must be able to negotiate these sensitive and vital issues with an informed, pragmatic, and ethical approach. The ultimate goal would be to produce public health professionals who can respond efficiently to a post-pandemic and to be prepared for future pandemics. Certainly, this COVID-19 won't be the last one. Here are some of my references, and I thank you for listening. Assalamualaikum warahmatullahi wabarakatuh.